Alrighty. Okay, well, my name is Katie Widener, and I work with the Prince Agency, and today we are going to talk about Medicare. It's an educational event, and we call it Medicare 101. The goal today is to give you an overview of what Medicare is, how it works, what the government recommends you have in place to avoid penalties, options to help reduce your out-of-pocket expenses for what basic Medicare doesn't provide. Because it's an educational event, I cannot discuss specifics on any particular plans or any particular concern you may have on a current plan. Those would be best addressed in a private appointment, okay? So without further ado here, I will get things started. So Prince Agency, how many here know us, are current clients of us? Okay, and who was referred here by a friend? Okay, great. So the agents currently on our roster are Melinda, the owner, and me. So that is my winter hair color. So, all right. So when it comes to Medicare, there are two parts to Medicare. There's Part A and Part B. Part A covers hospital care if you're in an admitted stay for at least 72 hours. It also covers hospice, skilled nursing facility following a hospital stay, and home health care. Part B covers doctor visits, mental health care, outpatient surgery, lab tests, durable medical equipment, okay? When you first qualify for Medicare, typically at the age of 65, unless you've been disabled, there's a whole nother factor there. But typically, once you turn 65, you're eligible for Medicare. If you don't have any other qualifying health coverage, perhaps you work for a large employer and continue to work past 65, then you are required to enroll in Medicare A and B. Upon A and B, the government recommends that you purchase a drug plan. They don't sell drug plans. You're required to purchase a drug plan from a private health insurance company. If you don't purchase a drug plan at the time that you enroll in a plan or within your grace period, there will be a monthly charge or a penalty, a late enrollment penalty, when you do apply. And we'll get into that in a little bit. So when it comes to original Medicare, those are the three pieces the government requires you to be a part of. Now, with those, Part A, if you've worked at least 10 years in your lifetime, has no additional monthly fee to you. You've paid into the Medicare system, a Medicare tax, so that is what you get provided when you turn 65. Part A also has a deductible of $1,600, and their deductible is a benefit period. It's not annual, it's a 60-day benefit period. So you could have multiple hospital deductibles in 1 year. Part B has a monthly premium. That monthly premium is based on your modified adjusted gross income from 2 years prior. So for 2023, they are using 2021's taxable income information. Now you wonder why there's a 2-year lag. Well, the reason being is those decisions on what premiums are gonna be and the cost of enrollment penalties are all decided in the fourth quarter going into the next year. So right now, CMS is figuring out what they're going to charge for 2024. The most recent information they're gonna have on file is your 2022 tax returns. So that's why it always feels like there's a 2-year lag. So they're using the most recent tax information that has been filed to determine what the best calculation is for the next year, okay? Yep.
How does that work if you file jointly, but the other joint person doesn't qualify for Medicare?
It doesn't matter. It's married filing jointly, your adjusted gross income for your tax household. So for Part B, if you're married filing jointly and in 2021 made less than $194,000 a year, your base monthly premium would be $164.90. If you were single and made less than $97,000 a year, then your premium would be $164.90. If your income was between $194 and $246, the premium is $230.80, and it continues to go up from there. This is adjusted every year based on the tax return for the year that's involved, okay? Along with that Part B premium, for your prescription drug plan, if you made the base minimum or maximum or less, there's no additional fee for your drug plan. If your income was in that next tier, they would add $12.20 a month to your drug plan premium. Excuse me. Hi.
Hello, is there a seminar?
Yeah, oh yeah, we're in full swing. Come on in.
Sorry, I'm
No.
late. The traffic was.
Oh, I know. Beltline is wonderful. We have some snacks, and then feel free to take a seat.
Oh, thank you.
So, I'll be happy to catch you up at the end. So basically, your Part B premium is going to be based on your modified adjusted gross income, and that's going to change from year to year, okay? So if we come back up here and we look, so we have A, B, and D, okay? That is required. As long as you have those three pieces, there's no penalties that that the government would apply to you for not following the rules, okay? Along with Part A having those hospital deductibles, Part B has an annual deductible of $226 this year. That is an annual deductible that's applied to the doctor visits and lab tests and such. Once that deductible's met, there's a 20% co-insurance on Medicare approved amount. So you would pay 20% of the bill, Medicare would pay 80% of the bill. If you happen to go to a lab outpatient service that doesn't accept Medicare payments, then you could be balance billed the difference. There is no cap on any of these out-of-pocket expenses for you. So how do we help cap those out-of-pocket exposures? There's two different ways to do it. Oops, I gotta go back up, sorry. One is, along with purchasing a drug plan, you can purchase what's called a Medigap supplement. Now, a Medigap supplement is purchased through a private health insurance company. You might hear coined terms like G or N, different letters, because there's different levels of a Medigap supplement you can choose to purchase. Our agency's position is to only recommend a Plan G, because Plan G has the best coverage for you. So how Plan G works is it would be a monthly fee. So you would have a monthly fee here paid to a private health insurance company, and a monthly fee here paid to a private health insurance company. And this Plan G, once your medical bill has been reviewed by Original Medicare, they will review, take off any deductibles and such that Original Medicare wouldn't take care of, and then they would send the balance bill over here to the Medigap supplement. And then they would pay the difference as long as it was a Medicare-approved supplement or a Medicare-approved service, and your only out-of-pocket service should be, or cost should be, your annual Part B deductible of $226. So let me explain an example. I like examples. My mom was in the hospital for 6 weeks. She went into ICU, emergency room and ICU in Sparrow for a week. She had end-stage heart failure that was undiagnosed. Once she had been stabilized there, they moved her to Spectrum for 5 weeks, and she was in ICU with life-saving procedures for 6 weeks' time. She had this setup of Original Medicare, a drug plan, and a Medigap supplement. She was 70 at the time. So the fun thing about Medigap supplements is every year your birthday present is an increase. So at about that time, she was paying about $200 a month for her Medigap supplement, so about $2,400 a year. But in that 6 weeks of ICU care that she had, there wasn't a bill to be paid. What Original Medicare didn't pay, the Medigap supplement picked up, there was nothing for us to deal with, okay? So $2,400 a year is a lot of money for insurance premiums, but that's what she got out of it, okay? So that's option one. Now with Medigap supplements, because it's a private health insurance policy and it's not a requirement for your health care regimen, the government has a rule set up with these carriers that when you first turn 65, you get a grace period that they have to give you preferred rates, no questions asked on your medical care. So you could be in the epitome of health or you could have significant health injuries. They have to give you preferred rates and they cannot ask you a question about your medical care. Okay? After that 6-month grace period is over, it's just like life insurance or indemnity programs. They can ask you medical questions and then they can rate you accordingly or deny you if you don't meet their eligibility standards. Okay? So that's option 1. If that is not a good setup for you, there it is. Instead of purchasing a drug plan and a Medigap supplement, you can enroll in an Advantage plan. Now, if you watch any football or any other TV shows in October or November of every year, you've seen those retired football players and retired actors talking about their silver sneakers and their dentures, right? Because that's what retired millionaires worry about. So, but what they're talking about are C for complete or Advantage plans. You'll hear a couple of different key terms for them. And an Advantage plan is a medical product, a Medicare product that is provided by a private health insurance company. So all the major carriers have their own Medigap or Advantage plan, Medicare Advantage plan. And how those work is the government gives a pool of money to that health insurance carrier when you enroll. And that money is provided to set up their program. So you'll hear a lot of commercials where they talk about zero premium and you're like, okay, where's the catch, right? So there is really no catch. What it is that the federal government is using the tax dollars that you've paid for original Medicare and they will give them to the health insurance company, and that's what funds your medical plan. So how Advantage plans work is typically most of them have no premium. And then it's a pay-as-you-go system. It's probably similar to what you're used to for your commercial health insurance, where you have co-pays, you have a maximum out of pocket. And so, for instance, primary health care on most plans has a $0 copay. So you go to your doctor, there's no cost to you for that visit. If you have to go to a specialist, there's a fee for that. If you have to go to the hospital, there's a fee for that. And then if you have a really bad year in and out of the hospital, in and out of therapy, God forbid you get cancer and have chemo treatments, there is a maximum out of pocket for every year that you have that plan. So they do cap your financial requirements on those plans. And then along with those plans are typically perks. There's usually gym memberships in there, dental, vision, hearing plans. Let's see if we have any. Oh, that's the next step. Wait, there's more. So they usually have extra perk coverages, and they're changing every year in regards to how much they provide. They provide over-the-counter benefits, which is usually a fee on a card, and you can go buy dental supplies and bathtub bars and everything else. So it's quite a helpful thing, and they're evolving every year because everyone wants your business. Now, when it comes to Advantage plans, every carrier has things different. Every plan is a little bit different. When they get this pool of money, they have to decide how large of a plan they want. Do they want a large network of doctors and hospitals, or do they want a small network of hospitals and doctors? Do they want an HMO where you have to go into those particular doctors to get care, or do they want to provide you a PPO, which gives you the freedom to go in and out of network for an extra fee? So there's different things like that. Then they can decide how big of a deductible they want, how small of a deductible, how many extra perks they want to provide. So that's why every plan's just a little different. So usually you can find a plan that's right for you. And then in those Advantage plans is a drug plan rolled in, so you're still meeting that requirement of having a drug plan in place. Okay, are we with me so far? Okay. So now that we've done a little overview, I want to share how drugs are paid, because prescription drugs are probably the biggest concern most people have. So when it comes to prescription drugs, there are 4 tiers on who pays what and why. And these are going to be changing over the next couple of years. I don't know who pays attention to what's being passed and what's changing, but the level of coverage for folks is getting better every year. So last year, if anyone is a diabetic, knows that injectable insulins were capped at a $35 copay for folks. This next year, they're going to eliminate the catastrophic phase, and in 2025, I think they're going to cap your overall out-of-pocket expense. So it is getting a little bit better for our folks eligible for Medicare. But overall, there's currently 4 phases of prescription drug coverage. The first phase is the deductible. The government sets what that maximum deductible can be. For 2023, it is $505. Now, each carrier can choose how they want to apply that. Some will apply the whole amount. Some won't apply a deductible at all. Some will only apply it on higher tiered prescriptions. When I mean higher tiered prescriptions, there's typically 5 or 6 tiers depending on the company. Tier 1 is preferred generics. Those are going to be a lot of your statins. Tier 2 is going to be regular generics. Tier 3 is preferred brand names. Tier 4 is non-preferred brand names. Tier 5 is specialty drugs. And now there's starting to be a more popular Tier 6, which is typically other diabetic drugs that don't fall in that insulin injectable state, okay? So once that deductible is met, if there is a deductible, you fall into the initial coverage phase. And here, the insurance company can reduce your out-of-pocket expense. This is where copays would come into play. A lot of them have a $0 copay for our preferred generics. They have copays for each tier or a percentage that you would pay. So even though you may be paying nothing for your prescription, the insurance company is paying for that prescription. And the total retail cost of that prescription is starting to add up during the initial coverage phase. So once your prescriptions that you've consumed equal a retail cost of $4,660 for the year, then you fall into what's called the donut hole or the coverage gap. And in the coverage gap, all of your copays switch to a 25% coinsurance on every prescription you have, okay? So some of your prescriptions, that might actually make your costs go down. In others, it will go way up. Once that number goes from $4,660 up to $7,400, again, this is not your out-of-pocket expense, this is just the total cost of your prescriptions that you consumed, then you fall into what's called the catastrophic phase. And for 2023, the catastrophic phase means that your out-of-pocket will drop to 5% of the cost. Unless it's a generic or a brand name, then there's a copay. For 2024, spoiler alert, there will not be a catastrophic cause anymore. So once you fall out of your donut hole, you're done with any payments. So that'll be nice for 2024. But 2023, these are still in place. Okay? So a lot of folks don't hit this, but prescriptions like Eliquis are $1,800 a month. Prescriptions like Humira for Crohn's is $6,000 a month. So I do have a lot of folks that go in and out of these phases quite quickly. So, any questions so far? I know it's a lot of information. I see the gloss. Do you have a question? You look like you're thinking of something.
Well, I'm on Eliquis, so
Yeah.
when you said that, I was like, oh my word, compared to what I pay now,
That's the retail cost. Your fee would be different. Your fee would be based on where it falls in the tiers and then go in and out of the donut hole. But in 2024, like I said, they are removing, it sounds like they're going to remove the catastrophic clause. Hopefully I can say that now. There's a lot of things I can't say till October 1st, but I believe that's all out in publication now, so I should be good. And then in 2025, they're looking to cap the total cost of out-of-pocket for folks. So, all righty. Trying to think what else I can talk about. Let's talk about late enrollment penalties and how those work. Because I've had a lot of folks lately that have come in that haven't had drug plans. So the rule that you had to have a drug plan in place went into effect in 2006. And by golly, I've had a couple of people that have been on Medicare between 2006 or even before that never purchased a drug plan. And so the cost of a penalty if you don't apply for a drug plan when you're supposed to is 1% of the national average of a drug plan for your national average times the number of months you go without. And if you don't apply for Part B when you're required to, for every 12 months you go without, it's a 10% penalty. And those are applied for the rest of your life. So I have a client who did not enroll. They chose to self-insure for a while, which is fine, your prerogative, right? Until they got sick. And so they're 2.5 years past the age of 65. And so between the two of them, they have $100 a month in penalties for the rest of their life. So, so the government doesn't, and the reason for those penalties, I mean, there is a viable reason. Obviously, if everyone waited to go on the system when they were sick, the system would collapse. So in theory, the healthy have to pay for the sick. And that's the only way that it's a viable
What is the
program.
period from the time you turn 65?
It's 6 months. So actually, when you first turn 65, your initial enrollment period is 3 months before when you can actually apply, 3 months before, the month of, and 3 months after. So your grace period before you start getting charged is going to be that 3 months after.
Now, is that if you don't have private health insurance?
That is credible, that qualifies. So if you have insurance through the marketplace, for instance, ACA coverage, that is not a credible coverage.
Right, but a work like employment. So how long, once you lose that employment, do you have after you turn 65?
8 months.
Okay.
But what I recommend for folks, because we work with folks a lot of times, so a couple of things that we recommend. When even if you're working and even if you plan to work past 65, we recommend that you come in and talk between 64 and 64 and a half just to learn how Medicare works. We go over something similar, except we'll go into detail on different plans. And the reason we do that is because it's a lot of information, number one, right? I've shared a mouthful of information tonight. And it's completely different than anything else you're used to. And so and then when you turn 64 and a half, you become more popular than the prom queen and have phone calls and paperwork that comes your way, and learning the terminology by having that meeting with us for 2 hours or an hour and a half, you'll get to understand what that terminology means. So when that paperwork comes, then you can have a better understanding of what you're looking at and actually read what these plans would like to share with you, okay? And even if you're deciding not to go into Medicare right away, it's good knowledge to have. And then if you decide to work past 65 and your coverage with your employer is ineligible coverage, then we recommend you meet us about 6 months before you're going to retire. So the reason being is, again, we want to refresh you with whatever new things are happening, because every year they change. And then we recommend you apply for Medicare 3 months in advance. It takes a good 6 to 8 weeks for the Social Security Department to process that, and you get your card, and we need a card in place in order to enroll you in any plans. So having those extra steps is helpful.
So if you already have your card,
Yeah?
like I just got mine yesterday.
Oh, congratulations.
So I'm good then, right? I mean,
So you have your card, and then you'll need to enroll in plans. So, whenever your effective date, as long as you're enrolling in a plan before your effective date for your Medicare. So let's say you're a 10-1, you're an October baby. So your Medicare is going to effect on 10-1, okay?
okay, use me for an example in January.
Oh, wow, they got yours early. Are you on Social Security? I'm sorry, that's probably personal, but.
Yeah.
So if you're on Social Security before you turn 65, the government automatically enrolls you in Medicare for your 65th birthday. And they're ahead of the game right now. We have people getting them 4 or 6 months in advance. We're like, we can't even do anything with you yet. So that's great. So January baby. So, and then just so you're aware, your Medicare benefits will go into effect on the first of the month of the month you're born. So if your birthday is October 25th, they're going to go into effect October 1st. If your birthday is October 1st, they're going to go into effect September 1st. So it's good to know that if you're the first of the month baby, that your benefits are going to start a whole month earlier. Okay? Yeah?
So I'm still working and I plan to still work. My employer offers insurance that I have now,
Yep.
but it's
Over 20 employees?
crappy insurance. And
Great, yeah.
That's why I wanna go on Medicare, because
Perfect.
I feel it'll be a better insurance.
Yep. I have quite a few folks that continue to work, but their plans are costly, and they found it better to go on to Medicare, and that's your prerogative. That's the nice thing about turning 65. You have choices. When you're a large employer, you're like, I can stay here, or I can go on Medicare. Okay, now to answer your question. So we can enroll you in plans, depending on the type of plan. A Medigap plan you can enroll up to 6 months in advance, but prescription drug plans and Advantage plans, the window is 90 days. So we recommend 60 days usually, because that way you can get your card and everything's all set to go for your January 1 start date.
So I should be making an appointment in the next 30 days.
That would be good. So just a caveat, open enrollment and annual enrollment start October 1st. I'm going to see a couple of you here soon. Every year you have the option to change your Advantage plan or your drug plan. That is between October 15th and December 7th. You have that option. So if you're on a Medigap, you can actually change those throughout the year, but most people don't usually change a Medigap plan. What typically happens is year 4 or 5, the Medigap costs get to a point where it gets a little uncomfortable for folks. And then you have an opportunity to either reapply to another company and see if you can lower your rate. If you're healthy and qualify, great, let's do that. If you're not, you can stay in that plan, or you can maybe consider an Advantage plan at that time. Does that make sense? So you have the option to change plans every year, Advantage plans and drug plans. Advantage plans can never ask questions on your health. They just have to take you as you are. Now, when it comes to picking Advantage plans, things that you look at are regards to prescriptions, obviously. Doctors and network. We try to find you a plan that has the most doctors that you currently go to, what's best for you. Ease of care, cost, perk benefits. It's just really what's unique to what you're needing for that year. And if that changes from year to year, then so be it.
So there's a cost to the Advantage.
Typically, right now, most of them are a $0 premium,
Okay.
because your Medicare tax dollars that you've paid into the system are paying it. So basically, how I like to explain it is CMS is paying the insurance company to take you off their books, off their payroll. So for instance, that same thing with my mom, if she would have had an Advantage plan, she would only show her Advantage plan card, and she would have paid her hospital deductible, which most of them, I don't know, it just depends, or not deductible, copay. They range $275 to $400 a day. There's usually a cap, 4 days, 7 days. It just depends on the plan and such. So she would have probably had about $2,000 in copays for that same visit, for that same 6 weeks.
So, but she paid $200 a month
For
for
this,
the Medicap.
yeah. There's no premium here, but there's copays as you go for the services you want. So x-rays, copays on hospital visits, physical therapy, each one of those will have a copay. But if you don't have any medical care for that year, then there's no fees for you to pay. And then included in that Advantage plan are usually extra perk benefits.
Okay, so the Advantage plans basically has co-pays, but it comes with perks.
Mm-hmm.
If you want to put it in short information.
Right.
But
So
the Medicare supplement, the Medigap, you pay for every month.
but then the out-of-pocket expense on the back end is limited. It's only $226 for your deductible. So think of it this way. This, you have more fees up front and less on the back end. And then the Medigap supplement, you pay as you go as you need it.
So basically, in my mind, so I'm just
Yeah, you're
trying to-
fine.
I'm trying to, make sure I understand what
Right.
you're saying. If you're fairly healthy
Mm-hmm.
and you don't go to a lot of doctors and, don't take a lot of medicine, then the advantage might be less expensive because you don't have that monthly premium.
Mm-hmm.
And you're
Yep.
just gambling, you're not gonna get in an accident or get,
Or have health issues, but your health issues, like I said, they cap your out-of-pocket expense, and they range anywhere from $3,900 to $7,900 in this area anyway, depending on the plan. So knowing that you have a max out-of-pocket is always helpful. And currently, less than 3% of Medicare Advantage members hit their max out-of-pocket in any 1 year. So don't let those numbers really scare you at the same time. I mean, it can happen, So I know of one particular client of mine that it did happen quite quickly, but I think the benefit to him to sharing that with me was that he didn't have any problems with his medical care being covered. So, he had a hospital visit and then cancer and prescription or surgeries and everything else. So it doesn't take long after you go through that, especially chemo kind of thing. But the max out of pocket, was hit, but at least he's capped on his out of pocket expenses. And so really, yes, if you go this route, if you're healthy, you're still paying a monthly premium. But if you end up in the hospital or go to the doctors and such, you'd have your doctor deductible. This year's $226. If you're healthy and you go on this plan, there's typically no premium. But then if you go to the hospital, then you have a copay. Copay's capped at so many days. You know that if you end up in physical therapy or skilled nursing facility or whatnot, you're going to have copays, and it's going to be capped on your out-of-pocket expense in any 1 year. So either way is not bad. And I usually get the question, well, why would anyone pick this if they have this? Or vice versa. I actually had 2 Medicare 101s in the same day. The morning group was like, why would anyone pick an Advantage plan? Why wouldn't you go this way? You got a monthly budget and you don't have to worry about it, and your out-of-pocket is capped. I was like, it's a great observation. Shared the same Medicare 101 in the afternoon with a different group. Why would anyone go this way and spend all that money if they're healthy? Why wouldn't they just go with an Advantage plan and get their dental for free? And I'm like, said the same squeal, almost word for word, done it for 4 years. And it's just funny how people observe and take in that information. So it's really just based on your personal needs. Yes, ma'am.
If you have an Advantage plan to start with, and later down the road you want to do something else, you can't go back to this, right?
Yes, if you can pass the underwriting guidelines. So when you first turn 65, there's no questions that they can ask you in regards to your current health and have to give you preferred rates. Once you're outside of that 6 months, this is an optional coverage. So they can ask you health questions, and you have to fill it out, and they will rate you accordingly or deny you if you don't meet their eligibility requirements. So it's easier, if you're thinking about ever doing this, it's easier to start here and switch here.
And then the other question I have is, my husband's already retired.
Mm-hmm.
He has this, plus
Yeah.
another supplement through where he worked. They help pay for it.
Mm-hmm.
Are you gonna talk about that too, or not?
I don't work with employer groups.
No, I mean, so as far as an option in terms of having Medicare plus an additional Blue Cross or Priority Health or whatever.
Depending on where they work, if it's like Steelcase or Nabisco and stuff like that, some large carriers sometimes will have a benefit where they will, if you go through their agency program, will pay for you to have a Medigap plan. And so they'll just pay it as a retirement
That's
perk.
what that is.
Possibly.
Secondary is a Medigap.
Yes.
thing.
Yep.
Okay.
Typically. So for instance, public school teachers, they have Advantage plans that are far better than anything we can get in the current market. And they can only get those through their ORS, their Office of Retirement Services. They can't come through me to get those, so they have to sign up through there. Nabisco, I learned this the hard way. The owner of the Nabisco company now, it's I believe a French company. I had a client that found out the day before our appointment to enroll him. I'm so glad he found out a day before. Got a phone call from the benefits department saying, "Hey, you're going into Medicare. I need to sign you up for a Medigap policy." And he's like, "Oh, I'm signing up tomorrow." He's like, "Oh, no, they'll give you $1,000 towards your benefits if you sign up through me." He almost lost out on $1,000, which is basically makes that Medigap free for the most part. And so he actually enrolled him in the same 2 plans that I offered him. So I guess kudos that I found him the best plans. But if he would have signed that next day, if that benefits guy would have called the day after, he would have lost out on $1,000 worth of benefits. So it's always good to check with those large employers because they may have some sort of perk available.
So is the Medicare always going to be the first thing billed once you're 65?
The service?
Yeah, like when you go into a doctor's
No.
office.
If you go the Medigap route,
Oh, okay.
then you're going to carry your Medicare card and you're going to give that, and then you're going to give them your Medigap card. So they will bill Medicare first and the Medigap second, and then you'll have a prescription drug plan card to share, okay? If you go with an Advantage plan, you can lock that Medicare card up with all your personal stuff because all you're going to want to carry is that Advantage plan card. That Advantage plan card would be for all your medical care, for your prescriptions, for dental, vision. And the reason being is because the federal government is paying them money to take you off the books. So if you show them your Medicare card and the medical biller bills them, you will get a denial letter that says Medicare's like, we don't take care of your bills. And then you're gonna call me and I'll be like, that's because, remember, you signed up for that. So, wrong card.
That's really funny, because, my husband never goes to the doctor. He's been retired. Or
Yeah.
he's been on Medicare for a while. I always said, just make sure you give him both cards.
Yeah.
And that could be,
Well, if they show both, the Medicare card, the medical biller is going to know to do this one. But I've had a few folks that just take their red, white, and blue card, and then they call me in a panic. They're like, "Why is Medicare denying my bills?" And I'm like, "Because you're supposed to give them the other card." And they're like, "Oh yeah, that's right." So yeah. You okay?
No.
What questions do you have for
No,
me?
I'm just gotta let it soak in.
Yes.
Well, I had coverage because I was working.
Yeah.
I'm working on applying for jobs, so I'm in like a weird area, like I don't know what to do, so.
Okay. And you're under 65?
No.
Over
I'm
65?
65 in April.
Okay, great. Okay. So when did you leave your employer?
Last day of May.
Okay, so you have an 8-month special election period, so right now you're okay.
Okay.
You'll have original Medicare, but you should probably sign up at minimum for a drug plan so you don't get a penalty, or look at other things. So just in case you don't get into a large employer over 20 people that qualifies. So, and I mean, it may be a good negotiation tool, or, a lot of insurance. I have a couple of folks that work at dealerships, and their monthly premium was $800 a month, and so they were able to come over. They purchased an Advantage plan, and now he's got more money in his pocket. So,
I have a question.
so yeah.
I thought I heard, in relation to her, that if you lose your coverage at work, you have the 8 months, but you only have 60 days to get the drug coverage, something like that? You can't be without drug coverage for a
Right.
certain period.
Right. That should be the 8 months.
Okay.
So, but I would not recommend going without drug coverage long anyway. So, and then when it comes to Advantage plans, something that recently came to mind from a week ago, I took a phone call from one of our agency clients. So when it comes to Advantage plans, there's an incentive provided by the government to these insurance companies to almost feel like they kill you with kindness. They're calling to make sure you're doing okay. They offer in-home visits. They give you little perk, $25 cards if you go have this, well check done or stuff like that. So they're always doing these little incentives, and sometimes it can get a bit annoying. But I had a client call last week, and this was something that I don't know, we're not aware of some of the perks they do. So, and she received a phone call from her carrier that they wanted to come out and just do an in-home well check visit. It was offered, you can decline, but she decided to do it. And it's a retired nurse that came to her door and checked her out, and she had some sort of like odd thing on her face or on her head and such. And he checked it out. He's like, I think you should have that checked out by a dermatologist. I don't like how that looks. And so she did, and come to find out, she's got a little spot there that is looking like it's cancerous. And she said, I asked my doctor about that 3 years ago, and he told me not to worry about it. And she said, oh, if it wasn't for that retired nurse, and if it wasn't for me having him come out, I wouldn't have had it checked. And so I thought that was a good benefit. So I realized that they can, like I said, kill you with kindness with all their things, but obviously everyone wins if they help you find resources to keep you healthy, right? They don't pay out more on medical care. You stay healthy, which is the key, right? Long, healthy life and such. And so I thought that was a really nice perk benefit that she was willing to share with us. So.
I have a question.
Yeah.
So, I'm still trying to understand some of it.
Sure.
The Medigap.
Yes.
Is Medigap a type, or is it
Medigap.
actual name of the insurance?
It's called a Medigap supplement.
Okay.
Yep.
So if
And
I
then-
wanted to stay with, like right now, I came in, saw you guys, and I have a priority health plan because I wanted to keep my doctors that I was already seeing. I'm not gonna get that if I choose Medigap.
Actually, you will, because when it comes to Medigap, you should, I should say.
Okay.
As long as your doctors accept Medicare,
Oh.
they have to accept the Medigap policy. So whether you go through carrier A or carrier B, it doesn't matter. They will bill that Medigap policy as long as they accept Medicare. So if they don't accept Medicare, you'll have to leave regardless. And then with Advantage plans, depending on the type of plan you choose, if you go to a small network, there's plans that are only in Mercy or only in Metro, plans. And so, if you want something narrow, usually those have a little bit lower out-of-pocket costs and such, but you're very narrow on your treatment. I personally, after experiencing the trauma with my mom, I focus on lots of options for folks. So because when we found out my mom had end-stage heart failure, it wasn't who's the best doctor in her network. It's who's the best doctor to try to save her life. Right. And so I really take that stuff to heart when I talk to my clients. So. Yes?
I was also told by a couple of my doctors that if I go with a Priority Health Medicare Advantage plan, I don't need a referral from any of my primary care doctors to go. I can go to anybody and they'll cover it.
So educational rules and CMS guidelines don't let me talk about specific carriers and specific plans for an educational process. But that carrier in particular, even under 65, has a general rule that if a doctor's in network, no referrals are required. It has nothing to do specifically with Medicare.
Gotcha.
So I miss that. I used to have that coverage. I have another coverage. I don't like it. So group health insurance, yay.
So when you guys book an appointment, how long do you usually try to allow to go over everything, to get set up?
It really depends on your questions and prescriptions. Usually prescriptions drive it. A Medicare 101 we usually schedule for 90 minutes per person. If there's a couple, usually 2 hours. I know couples enjoy doing that together, but if they both have long lists, it becomes very exhausting for everybody. So I do try to break that up. So what's benefit? And I have some couples that have to do everything together, and one will sit through that twice, and I have others like, I don't know what he's doing. I'm coming to see you. He can figure it out. So I'm like, that'll be my husband. And I don't know. He can figure it out. So yeah. So about 90 minutes usually.
And you're talking about the first time?
Yes, the first time.
Medicare.
Right, for Medicare 101. Enrollment, if you know what you're going to go in, then, it takes less than an hour to get everything applied and such. It's just really, every company does their enrollments differently.
Yep.
Some take a little longer to get through the process than others, but it doesn't take too long. So for the enrollment, and usually there's follow-up questions, so I usually book an hour for that. And it doesn't mean that we have to take the whole hour, it just gives me extra time to do my paperwork at the end if it doesn't take that long. We can do them virtually, we can do them electronically. I have folks that on the other side of the state. So, we do a virtual appointment and then we do all the applications electronically. So that everything, thanks to COVID, has really pushed all those carriers to really put things online, which has made the processes a lot nicer and such. There is a new rule coming out in October 1st. Currently, we have to have what's called a scope of appointment. What that is it doesn't mean that you're going to sign on with us. It just gives me written permission to talk to you about Medicare. And typically, those are only good for 14 to 30 days, depending if we get them ink or electronic signature. Starting October 1st, we will need to get those 48 hours in advance before your appointment, and then they're good for a whole year. So when you're scheduling an appointment, we will have to send you an electronic document asking you to sign, saying it's okay for me to talk to you about what you're coming to my office to talk about. And
So
then
can we sign those tonight?
they're only good for 30 days. October 1st. I have to wait till October 1st to have them good for a whole year.
Oh, okay.
Yes.
So I have an appointment October 11th.
Okay.
Do I have to sign that paper then?
We will send that out 3 days, usually 3 days before your agent will. Yep. So we're during open enrollment, annual enrollment. So annual enrollment for Medicare is between October 15th and December 7th. Open enrollment for our under 65 group is between November 1st and December 15th. So if you are turning 65 or if you want to have those things looked at during open enrollment, now would be I can't take appointments today due to CMS guidelines, but you can call the office to set up an appointment tomorrow if anything needs to be in. But it's a busy time of year, so if there's a time that you want to have an appointment booked, the sooner the better.
Sorry, was it October 15th through what day?
So you're different.
Okay.
That's for annual enrollment. That's for folks that are already enrolled.
Oh,
You have your card, so you could come in. Let's see here, January, anytime after October 1st.
oh, okay.
So what other questions do we have for me? Why do I love my job? No.
If we saw one agent, doesn't matter who we see the next time.
No, it does not.
Okay.
So no. So actually, I guess I shouldn't say that. You obviously can call and talk to any of us, but we're all independent agents on straight commission. So whoever you see, that will be your agent for record. So. What other questions do we have for me? Anything you'd like me to review again? I know it's a lot of information. That's why we put on these educational seminars. We put them on every month. If you're on our mailer list, we do different things. We've done estate plan attorneys. We've done some different financial ones. So we try to find things that we think our clients would find beneficial. Obviously, we'd love it if you share those those ideas with other people so they can get this benefit as well. This will be the last one for this year because we're getting ready to go into annual enrollment, and so we'll all be sitting here with our hair on fire with appointments for the next couple months, but they will start back up in January or February again.
What were you talking about before about if you were still working, you had to do something 6 months ahead?
No, I would recommend 6 months before you retire to come in and get a refresher on what your options are. And then we can also give you the timeline on when you have to apply for Medicare. So it's just a guideline.
That's if you're retiring.
Right. If you want to go into if you want to just enroll in a plan, then I would do it during open enrollment if you're already past 65, because you need what's called a special election period or an annual enrollment. So if you turned 65 last year, let's say, and right now you're in the middle of it and you want to change, there's certain rules on when you can apply for these plans. So Advantage plans and drug plans you have to purchase during annual enrollment unless you have a special reason that you can. A special reason would be like retiring, okay? There's one caveat for Advantage plans. There's a 5-star rating, so they live and die by their ratings. And if a plan has a 5-star rating, they can sell their plan all year long. So if you're currently in Plan A and you don't like it, maybe you got a prescription that is not on their formulary, then if there's a 5-star plan in your area, you can switch over to that, no questions asked. If there isn't a 5-star plan in your area, then you have to wait till your annual enrollment to change for the next year. Something else to talk about real quick in regards to formularies, that's a big word for a list of approved prescriptions. Each carrier is required to have 2 prescriptions per disease category. So one plan might have Humalog and the other one might have Novolog. So it's always good to have a list of prescriptions and doctors so that we can review what might be the best plans for you for the year you need it.
You mentioned those diabetic medicines that are not insulin, those are always all gonna be, level 6, which is the highest.
No,
right?
some of the carriers have level 6, have a tier 6. So the reason why there's tier 6, it doesn't have anything to it that being high.
Okay,
It's just, it was the next number available.
okay,
So what they've done, so when it comes to prescriptions, they've decided to just give them their own category so they can decide maybe a different copay. Maybe they, before they were a tier 4 and you had a 40% coinsurance, but now they want to give you $11 copay. So they just had to come up with a new tier so that they could put what they want for those copays. So that's all a tier 6 is.
Put me in the donut.
The donut hole, yep.
And,
Yep.
So,
Well, hopefully that's going to be, that'll be changing here over the next couple of years. Hopefully you'll see a little bit of relief there, which is the goal. Well, I feel like the glossiness went away and I've seen the color come back in most of your faces, so hopefully that is a sign that I did okay in explaining things to you. My cards have been provided out. There is a permission to contact slip if you'd like to fill it out for one of us to reach out to you at a later date to chat more. There is no fee for our services. We're actually not allowed to charge for our services. So what happens is once you've enrolled in a plan through us, the carriers will pay us a fee. So but that benefits you for a couple of reasons. Number one, whether we spend 30 minutes with you or 3 hours with you, you don't have to worry about whether or not that's going to hit your pocketbook. And number two, that provides you the advantage knowing that we are just going to show you the best plans for you and not what plan might be more beneficial to the actual agent. So we do our best to represent every carrier that allows us to represent them in Michigan. A couple of our agents are insured in other states as well, and to try to help friends and family in other states. So, but when it comes to our clients, we do our best to find, there's 2 new carriers that are coming to Michigan that are setting up plans, and we're in the middle of getting contracted and certified with them to review their plans so that we have just more options for our clients. And then when it comes to training, just to give you an idea, every year we have to recertify with every carrier that we want to write with. And so it helps you guys know that we are all knowledgeable in the plans that we're looking to provide you in the years coming. Any other questions? So if there's any other questions, you're more welcome to stay afterwards and talk with me privately if you'd like. Otherwise, I really appreciate your attention today, and I hope you found that this is beneficial for you. And I appreciate you coming. Thanks for listening.
Thank you.